I chose vascular surgery for multiple reasons. First and foremost, I really like the range and breadth of procedures. They're very technically challenging. They range from very straightforward procedures to very complex procedures. I love my patient population. I really think they're a unique population who I can really improve their life, I can prolong their life, and more importantly, unlike other specialties, I get to know them. And so all my patients generally see me once a year, sometimes more often. I get to know them, their family, where they're from, and most of them are Texans, and I love my fellow Texans, yeah. I'm board certified and trained in all aspects of vascular surgery. So that ranges from veins to peripheral artery disease to aneurysm disease. But in particular, I really have a passion for limb salvage. And limb salvage is for patients who have difficulty either walking, they have pain in their legs, or they may even have developed wounds or ulcers that can lead to serious things like amputations. And these are all consequences of patients having blood clots or poor blood flow to their feet. My favorite parts of our limb preservation program is really the feedback that we get from patients as well as their referring doctors. The cost of a patient and society for limb loss is really difficult to measure, and it's quite profound. But our patients, when we save their limb, it often saves a high quality of life. My job's rewarding because I really can often, one, save their life, two, I can make their life better, and three, I get to know them. And we develop a relationship. And unlike other surgical specialties where you may see them once, do the surgery, don't see them again, I try to see a lot of my patients for the rest of their lives. And it's really, really rewarding.